Go.
Hi, my name is Antoinette, and I am the nurse for our wonderful patient, Miss Quinteria Carter. So today we're going to be doing a full head-to-toe assessment. Do I have your consent?
Yes.
Okay, so first I'm going to start by asking you a few questions. So the first question I want to ask is, can you tell me your middle name and your date of birth?
My middle name is Saya, and my date of birth is February 23rd, 1994.
Beautiful, and do you know who the president is?
Yes.
Okay, great. Also, I want to ask you, do you have any flu or cold-like symptoms before you came in for your visit today?
No.
Okay, and do you have any history of asthma?
No.
Any history of pneumonia?
No.
Do you have any updated vaccinations?
No.
Your vaccinations are not updated?
Well, I did get the flu shot.
Okay, so are you vaccinated with your PPD?
Usually I'm a false positive, so I usually get an X-ray.
Okay, good. I'm so glad to hear that. And do you have any complaints of chest pain?
No.
And I also want to ask you, have you had any respiratory distress lately or anything?
No.
Your breathing, no problems? Okay, and any pain?
No
anywhere?
pain at all.
Okay, before we start your assessment, I want to know, do you have any concerns that you would like to share with me before we start?
No, not at this moment.
Okay, beautiful. Okay, so our full head to toe assessment is just that. It's going to be a full head to toe assessment. So first, we're going to start with hand hygiene. And I've already introduced myself. I'm Antoinette, and this is our patient Quintera, and we're going to do this head to toe assessment. So first, I'm going to start by assessing the head. So I'm looking at the head. I'm feeling for any lumps, disfigurations. I'm looking at the skin to see for any scars or bruising or unusual marks. I'm also looking at the symmetry of the face. As you can see, what is to be midline, the nose is midline, lips are midline, ears are equally and bilaterally in place. Eyes are also bilaterally in place. As far as entire facial features and facial structure and bone structure, her face is symmetrical and there is no masses or lesions or any signs of disfigurations to the skull, the back of the head. Is there any pain when I touch you here?
No.
Okay. I'm going to go ahead and I'm going to assess your temporal arteries.
Okay.
Tell me if you feel pain.
No pain.
Okay. Pulses are palpable. Okay. And I'm also going to palpate your mandibular joints here. Any pain?
No.
Okay. Can you smile for me? Can you puff your cheeks? Beautiful. Also, can you squeeze your eyes tightly together? Wonderful. Okay, and can you wrinkle your forehead? Good. So we can see that the patient is following commands and the patient is able to express all of those features there. So we know that there's no issues, any pain, or any concerns to the patient not being able to respond to sensation or be able to move joints at this time. Also, now we're going to assess the extraocular eye movements. So we're going to assess cranial nerves 3, 4, and 6, okay? So I would like to shine this light into your eyes. And it might be a little irritating, but just look at me. I'm going to check to see for pupil constriction. Well, first we'll go ahead and we'll test the cranial nerves. Just follow the fan. Beautiful. Cranial nerves 3, 4, and 6 is intact. Okay. Also, now we're going to go ahead and assess the pupillary response. So when I shine the light, I see pupillary constriction to a size about 2. So that's wonderful. We have no response. Now I'm going to go ahead and I am going to ask Ms. Quintera to follow some commands in regards to the movement of the tongue and the mouth. So I'm inspecting the lips as the mucous membranes are pink and moist, so no signs of dehydration. I want to go ahead and have the patient stick her tongue out. Go ahead and stick your tongue out for me. Beautiful. Now I want to look at the teeth and the gums, and the mucosa of the gums are pink. They look healthy. No signs of any type of oral disease or anything like that. Now I am going to go ahead and palpate and locate the landmarks of the thyroid as we're moving down from the head to the neck. So not too hard, but I'm palpating for the thyroid. Can you swallow for me? Okay, beautiful. Any difficulty swallowing?
No.
Okay. So now as we're moving forward with our assessment, I'm going to go ahead and I'm going to auscultate the carotid artery with the bell of the stethoscope. The bell of the stethoscope is bestly used to go ahead and auscultate for the carotid artery. Okay, beautiful. So I've auscultated for the carotid artery, and now I'm going to go ahead and I am going to auscultate the 5 points onto the chest, as we know as the aortic, the pulmonic, the Erb's point, tricuspid, and mitral points on the chest. So assuming that the curtain is closed and we have privacy for the patient, I'm going to point and I'm going to verbalize where I'm auscultating on the patient.
Do you need me to lower this part a little?
Yes, with the curtain closed. Okay, that's it. Okay. So, auscultating, I'm going to start with the aortic here. And we're currently auscultating heart sounds. This is the pulmonic. And then this area would be Erb's point, tricuspid, and mitral. I would also like to verbalize that S1 is best heard with the bell side of the stethoscope, and S2 is best heard with the diaphragm side of the stethoscope whenever you're doing your assessment. So moving forward, I'm going to go ahead and I'm going to percuss the posterior lung fields. So doing this, I will be behind the patient, and the patient's back is exposed. And of course, with the curtains drawn and for privacy, the entire back will be exposed. So basically, when I'm percussing, as I put the ulnar side of my hands bilaterally symmetrical to the patient's posterior lungs, I'm going to have her repeat 99. 99?
99.
99?
99.
Okay, equal vibration on both sides bilaterally. Okay. So now I'm going to go ahead and I am going to, and by the way, just in addition, the patient saying 99 as I am percussing the posterior lungs is basically for me to assess for tactile phlebitis. So now I'm going to go ahead and I'm going to auscultate these posterior lung fields, the anterior lung fields, and the lateral lung fields. So I'm going to do this by taking my stethoscope, anterior lung field, breathe in, out, breathe in, out, and the patient's going to turn here so you can see. Anterior oscillation here and here. Raise your arm for me. Breathe in and out, in and out, in and out, in and out. And now I'm going to go ahead and auscultate the posterior lung field. Turn it back this way. Thank you. In and out, 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 in and out. Okay, auscultation on all lung fields result in clear breath sounds, which is what we want to hear. Beautiful. So now we're going to go ahead and we're going to inspect the abdomen. So I'm going to ask our patient to lie on our medical examiner's table as we assess the abdomen. Okay, so with assessing the abdomen, I'm going to start by not only having patient lying flat, but I'm also going to examine the skin. So what I would do in this instance, with the curtain drawn, the abdomen is exposed, and I'm looking at the abdomen for any abnormalities such as any bruising, any bulging, any masses, anything that's unusual during an assessment of the abdomen. And then I'm going to go ahead. So that will be my inspection. And as I would know, the patient does not have any bruises, masses, or any alterations to the skin or anything that I should be concerned about. So she would have successful or pass the inspection part of the abdomen assessment. And then we're going to move forward with going auscultating the 4 quadrants. So by doing this, we take our stethoscope and we auscultate for a few minutes, usually listening for bowel sounds. And I hear bowel sounds. And with the bowel sounds, it's showing that there is no obvious signs of blockage in the intestines. There's bowel sounds present in for all 4 quadrants. So now I'm going to go ahead and I'm going to percuss the lower liver border. So doing this, I'm just going to go ahead and let me know if you have any pain. So percussing the liver, I feel here, percussing the liver, there, palpating lightly. Any pain?
No.
Okay. Okay, now I'm going to go ahead and palpate the spleen. Any pain?
No.
And now I am going to go ahead and palpate the right and left kidneys. Any pain?
No.
Any pain?
No.
Okay. The aorta? Any pain?
No.
Okay, beautiful. So moving forward with our assessment, I'm going to have the patient sitting up. And now we're going to go ahead and assess cranial nerve number 11. So basically, we're going to be testing for resistance. I am going to have you push your head against my hand, left and right, and I want to see if you'll be able to resist. So go ahead and push. Okay, good. There's good strength there. And then I'll come onto this side. Turn. More. Good. Very well. Continuing with our assessment, I'm going to place my hands over the shoulders of the patient, and the patient will be able to shrug against my resistance. Go ahead and shrug. Beautiful. Any pain?
No.
Okay, beautiful. So now I'm going to ask the patient, can you pat your knees with your palms? Okay, I see a reflex there. And also, I'm going to ask you to do a finger thumb test. So the finger thumb test is simply like this. I want to see if you can touch your thumb and